This podcast encourages and empowers you to create your own unique real story, develop your own unique real statement, and discover your own unique real self. The power is yours. Good night, Karen Laing. How are you doing on this wonderful, beautiful night?
I'm doing absolutely fabulous. I've had a great day, and I am totally looking forward to this.
Well, that's wonderful. I am as well. What part of the world are you in right now?
I live in New York State in a little town called Schenectady, New York, right outside of our capital of Albany.
All right. Well, do tell me which of your talents is responsible for us connecting at this specific time in history.
Probably just my ability to network, because I got connected to you from a woman who's done some marketing work for me. But mostly it's because I'm a public health educator, and she thought we would have a good time talking to each other.
That's wonderful. What's her name? Please tell me her name.
It's Jody Solis.
Oh, there we go. Yeah, well, that's great. Small world, right? I love that.
Yes.
Yeah, she was on the podcast. That's wonderful. Yeah, tell us a bit more about what you do around health, please.
So I teach people how to use the healthcare system, how to pick health insurance, how to communicate well with their doctor, as well as how to make healthy lifestyle choices. So several times today, actually, I was out teaching a new class that I have called Better Grades Through Better Health Habits. So I taught to a couple college students classes this morning, and to a youth program this afternoon on things that they can do from a health perspective that will improve their grades.
Give us an example of one thing, please.
So it was basically came down to 4 really quickly. It's drink enough water, get enough sleep, eat healthy food, and learn to de-stress yourself.
Ooh, I think the de-stress yourself is a big topic, isn't it?
It is. Although amazingly enough, a lot of today's focus for all 3 groups was on drinking enough water.
Ooh, let me do that as we speak. I just did that.
For you.
I totally agree. Drinking enough water, the day goes by so quickly, and then the air conditioners keep us cool, so you don't really feel as though you need the water. And I'm guessing with the current season that America is going through, it happens even more. Is that accurate?
Probably, and I think we just don't understand enough about how desperately our body needs water.
That's amazing. One of the statistics you had on your bio is that 88% of Americans are not able to communicate with their doctors. I know in Trinidad and Tobago, my wife is in this, and she always would say that people would leave the doctor's office and then ask the nurse, "What did he say?" And she said she never understood. Why wouldn't you communicate with the doctor while you were sitting with him? What do you line it up with? Happens there?
I think some of it is intimidation. I think sometimes the doctors sometimes they feel like they don't want to bother the doctor. I get that a lot. I get a lot of people who will call me and ask a question at 7, 8, 9 o'clock at night because they don't want to bother their doctor at home, or don't want to bother their doctor, in his off hours. And I'm like, but he's your doctor. And I am your friend, and I don't mind taking your phone calls at 8:30 at night, but if you need medical advice, you need to call your doctor.
I totally agree.
And when they're in the doctor's office, sometimes they think they understand, and then they get out and they get questions, and they're not sure who to ask or what to do about it.
So who did you learn this ability to care for others from?
So I actually started my life as a special education preschool teacher, and then did retail training for a long time. And then I discovered that I went back to school to be a public health educator. And I discovered this whole concept that said people don't understand how to use the healthcare system. And I thought, well, this is silly. We should teach people. And yet nobody was really out there teaching people. So my company actually won an award 2 years ago for being the first company or organization in the country to teach people how to use the healthcare system.
Wow, congratulations. Well done.
Thank you.
Well done. So where's the best place for someone that's listening to connect with you?
So the easiest way is to find my website, which is healthliteracyforall.org, or to find me on Facebook under that same thing, or in LinkedIn under my name, Karen Burhans Laing, and the Laing is Laing. Any of those are really easy ways to get in contact with me and to ask questions.
Do tell me one other thing that you've done consistently over the last 3 years, please.
So about 2.5 years ago, I started taking my classes and turning them into books. And I have really enjoyed that process of being able to take, and in fact, one of the books is how to de-stress yourself, but how to take that information and make it accessible to people who can't get my classes live and in person.
That's wonderful. Where can we get those books?
Those books are available on Amazon.com and on Kindle.
How does it make you feel to see what you've built up? The small kingdom, the mini kingdom of help. How does it feel?
It feels great. I love when I can go into a community and people get it and understand and change. I had a senior citizen last year who came to me and said, because you've been coming in and teaching these classes to me. He's 86 years old. He came off his diabetes medication and his high blood pressure medication and is taking no meds because he learned to manage his health. Wow. And that's just thrilling.
Yeah, I can well imagine. It's like you've you've actually saved a life and empowered someone.
Yes. Yeah. It's really neat to really be able to empower people, and especially when I'm working with young people. And to know that they are going to be able to spend the rest of their life handling life well.
That's wonderful. Now, there's someone out there, a trainer, or even someone in the beginning stages of their dreams of how they want to help someone. Why would you suggest they do what you've done by starting and then being consistent with it?
Right. So I think the whole thing is to find what you're passionate about and actually start. I know so many people who have a passion for something, but they don't start. They don't take that first step. They don't get a training or an education or a piece of that at all. They get stuck in the dream, but they don't make that dream a reality. And I think just taking those steps forward, finding the people who can inspire you. One of my friends, when I started this, gave me a book on how to create a nonprofit so that I could make my business into a nonprofit. I mean, step by step, people have come alongside me. All sorts of different people from different areas of my life have come alongside me to help me do this well. But I had to take each of those steps and follow the process and continue on. So that's my advice for people is find what you're passionate about and start doing it.
I love that. Definitely amazing audience. Fear is there. It's a factor that doesn't move. But the faith in the model of making that step when you don't even see the step is part of the parcel, isn't it?
It is. It's starting out and just figuring out, kind of flowing through and where you're going to end up. I really thought when I started this field, I was going to be doing individual one-on-one counseling. And then I realized that one person at a time was never going to change the community I lived in. And I needed to do it in group classes instead of individually. And that altered me into doing it as a non-for-profit instead of a single business. So, you just start going and then you just look for where the next logical place to move into is or where to go is next.
Karen, let's switch gears for a moment now. Let me invite you into my time machine that is surrounded with beautiful, warm, blue Caribbean water. Karen, what is your earliest childhood memory?
My earliest childhood memory is one of myself and my brother, who was a year younger than me, crawling around my baby brother, who was about 3 months old at the time, trying to teach him how to crawl.
Why do you think this memory is so clear?
I think it was because it was my brothers and I have always gotten along well, but we've never really connected as a family in a lot of ways. My mother had some long-term dementia problems that interfered with us being able to connect as a family. But it's one of the things that I remember, I think, the most, because it was a time where my brother Stan and I worked together to try to accomplish something. I mean, we were trying to accomplish teaching a 3-year-old to crawl, which is impossible, but we were working at it together.
That's powerful. How do you see that memory connecting to who you are today?
In some ways, and it's really because you put these questions up and I got to thinking about it. I think it's one of my favorite memories, because I was trying to teach somebody how to move forward in life, how to be better, how to move their lives into where they needed to go next. So I was doing that at 3.
That's beautiful. Well done. Love the way you connected it. Love it, love it, love it, love it. All right, Karen.
And I honestly never thought about it before until till you had that question up on your website and said, what's your earliest memory? Yeah. My earliest memory is teaching.
It's amazing. It's amazing as well. You weren't shouting. You weren't shouting at the 3-year-old. You decided to do it from an influential perspective, where you took action, hoping that person would take action as well. It's very beautiful. Yeah.
Thank you.
You're welcome. If we fast forward to when you were 12 years old, what was your favorite song?
I'm not a huge music fan, but I loved the Carpenters. And, almost anything from them, that quiet, mellow music, although that's not surprisingly enough, not my style at all now. My style is much more reggae and more jazz and more louder music, more energetic music. But back then, I think I just needed that quiet music.
All right, my friend. Well, we've arrived at our destination, but before we get off of this time machine, there's a small declaration form. So it's yes or no. We're going to move pretty quickly here. Are you ready, Karen?
Yes.
Karen, have you chosen someone to pass on your skills to?
I have, yes.
Are you married?
I am married.
Do you have children?
I have 4.
Do you believe in God?
I do believe in God.
Do you have an inner circle of friends?
I have a great inner circle of friends.
Do you watch TV for more than 3 hours a day?
Not usually.
How about 3 hours a week?
I probably watch about 6 hours a week total, and I probably do one of those in a long spurt of 2 to 3 hours, but I'm not a huge TV watcher.
What about screen time? The phone and the computer, is it more than 8 or less than 8 hours a day?
It's probably more, but that probably has to do with I use the computer a lot for marketing.
All right.
So a lot of my business is drawn from the computer more than like wasting my time on it, playing games on it, that kind of stuff.
Karen, if you had to share with us your own unique real statement, a statement that represents who you are, what would you say that is?
I am gifted by God as a teacher, and I want everybody around me to live a healthy life, whether that is physically, mentally, socially, or spiritually.
Love it. Karen, this was such a great pleasure, my friend. Before you leave, is there anything else you'd like to share with our amazing audience?
I don't think so. I have so enjoyed having this conversation with you, though.
I appreciate that. That means a ton to me. Love it. Karen Laing, thank you for being on What is Inspired by 12-Minute Convos with Angel Jones.
Thank you.
You're
Have
welcome.
a great night.
Thank you.
This segment has been brought to you by Amazel Enterprise.